Hello and welcome back to Unacademy. So let's quickly Dr. Muskan over the other DNA viruses that we are left with. Starting with the Unacademy is India's largest learning platform, live and you can watch and record it there and from the India's topmost any medical examination, be it NEET and complete live TNTs and test of preparation with highly competitive quizzes. Study on the device and assess up to 25,000 of MCQ and we need to cover 52 MCQ for good practice. And we have a bunch of 25 MCQ, all the important topics. Printed notes are being provided now. ICO subscriptions PrepLadder has come together with the Unacademy that clinical interactive integrated essentials, video lectures from the banks, repeated notes, and treasure ring note. With well structured live batches, recorded sessions, two banks of 25,000 and competitive day and notes. For 2 year, it will cost you around just 1,500 per month or 6,000 and please that is at 10. And for icon subscriptions, it will cost you 1,038 per month account per or for 2 years. And use my code that is Muskan 10 to get 10%. You can personalize your interactive, make your classes interactive with interaction with survivors and the doubt solving sessions with the right now updated and the highly effective QBanks with 25,000 high yield MCQs and based on the examination pattern and skill explanation. Special class features include interactive live classes with tools for the learner so that they respond to better understanding of the topic and raise their hand to talk to your favorite educator live class and gets your doubts solved. Never miss a class because you get notification for and with lecture notes that are being provided and anywhere attend live classes, participate in the live chat, and get your doubt class all during the live sessions. With 24 month subscriptions, 2 months is totally free. 12 month subscriptions, 2 months that is must get 10% discount. Now starting with the pox virus, starting with virus. Now pox virus, as we remember the mnemonic that pox is out of box. The pox is out of box. So one is that it is the largest virus. Other than this box, that is it is break grape virus. Alright, and they infect animals. They are medically important specifically. One is what that is called smallpox. Alright, and vaccinia that is for the vaccination that is given for smallpox and the molluscum contagiosum virus. Vaccinia can be differentiated from the variola by that is the inclusion bodies that is in the vaccine coronary body and the in the variola we have what passion body. All right, and the vaccinia pockets in the coronary Atlantic membrane are larger and hemorrhagic than that of the variola, and the ceiling temperature, the highest temperature beyond which the pox for vaccine it is around for vaccine and variola 8 degrees Celsius. All right, so what is that key point that we need? That it is the largest virus, it is a big ship virus, and the variola that is a causative agent Smallpox, there is difference between vaccine that inclusion bodies for the are the Gonorrhea body and for the variola for the variola pastures the pastures. Okay, and the on the temperature, we talk about the temperature that is the highest temperature before the pox for the vaccine around 8 degrees and for the Celsius. Now, smallpox eradication, because there is one point, there is animal reservoir. There is no animal. Second point is that patient is the only patient itself is the source, and therefore there is no carrier state. There is no carrier state. Patient is the only source, and the case detection is easy. The rash, the characteristic rash, and the some clinical cases doesn't. International cooperation and highly effective live vaccine. So, what is the important point? The smallpox eradication is it is a human pathogen, and there is carriers. There is animal reservoir. Their patient is subclinical. This doesn't subclinical cases doesn't with the disease and case the characteristic rash along with the vaccine that is highly prepared for the vaccine, and it is what it and the I use multiple techniques. The last natural case of the Bangladeshi 90 Assam way, or at an last natural case of the small miners in the America that is in 1977 and eradication was declared 8th of just remember the point that smallpox eradication why it's easy because the source is what source is only patient case detection was easy and international cooperation with the live vaccine that is highly effective. Alright, last natural case was the Bangladeshi wound and the eradication was on the 8th. Now smallpox the incubation period is 7 to 17. Alright, so smallpox incubation was 7 to 17 days, 7 to 17 days, right? And for the chicken, 10 to 21 days. A rash on the palm and the soles are present, and the smallpox rash are what the deep-seated rash that elevation and centrifugal. The chicken pox superficial, and we read yesterday that are drops on rose petal appearance. Okay, that is the dew drops on the rose petal appearance. Smallpox subtype with the appearance of the rash and the fever rises with each drop of the rash. So, what is the important point? The smallpox, the incubation period is about 12 days, and for the chicken pox is around 15 days. The chicken pox rash are the superficial that is dew drops on rose petal appearance because the filled vesicles are present in the space. The smallpox rash they are what? A deep. Now coming to Muskan contagions, humans are the only host. It is mainly seen in children. Alright, and they are severe in the patient's compromise. And the patient will present with early, patient will present with early or the patient will present with pearly white skin nodule and eosinophilic inclusion bodies that are what mollusk bodies also known as Anderson Hpv body. Very important point that they cannot. Okay, so what the important points must just are the humans, they are mainly HIV and they are seen pearly white walls and Henderson HPV. Now, the Henderson Peterson bodies also has come. You can see the intracytoplasmic particles in the solution body and Montescum just have the sun bodies. Alright, and these are type the what cytoplasmic bodies. Alright, so what like skin contours with a dimple in the center, with a dimple in the center, very important. With a dimple at the alright, key points that we need to see HIV, and we see the pearly white wall with dimple in the center. And what are the inclusion bodies? Are hand bodies which are cyto inclusion bodies. What are the other pox viruses which infect animals? One is the pseudo cowpox, that is what milk and orf contagious pustule dermatitis. Now coming to adenovirus, that is what adenovirus is. The virus we are reading the DNA virus, and it is a non-annular virus. Annular. Another mnemonic that is BARB. Yeah, that is A is what adenovirus, which vehicle space adenosine satellite shaped virus. Is what satellite shaped virus and adeno associated viruses. They are defective viruses and they require multiplication. Now, the disease that are caused by the adenoviruses, but in the new the fetal disamination, the infants it causes nausea and the pharyngitis in the children, respiratory tract disease with hemorrhagic cystitis, diarrhea, and infection in the young adults, acute respiratory disease epidemic, and immunocompromised will cause what? Cause a liver infections. Now, coming to the next virus, that is what? Coming to the next virus, that is the parvovirus. Now, parvovirus, they are what? They are small virus, and the largest virus was the pox virus. And parvovirus consist of what? They consist of just like RNA, they consist of single-stranded DNA virus, and it causes the fifth disease or arrhythmia. It causes out infectiosum, or the fifth disease that is characterized by the rash, arthralgia, and lymphadenopathy. That is what SLAB syndrome, SLAB appearance. Okay, that is important to remember. One is that it's the smallest virus, and it is an exception that DNA virus are double standard, parvovirus single standard DNA virus, and it causes the fifth disease or infectiosum, that is what scabbed cheek appearance of the rash, causes the aplastic crisis in sickle cell anemia and pregnancy, cause non-immunoglobulin hydrops, polyarthropathy, that is is 50. Many the women the metacarpal hand joints they called most common hand joints called. Alright, transmission is to the respiratory route. So one thing we need to remember that one is that it is virus plus the virus and it causes the fifth disease, infectiosum stabbed virus, stabbed chicken virus. Now coming to the next that is the papovirus. Papovirus that is what? Words that is we are talking first about one papillomavirus that is HPV. Alright, in the HPV type 6 and 11 that is what low risk and it will call carcinoma. Other is 60, 80. This will cause carcinoma, high risk. And the last one, that is the risk factors. The risk factors, remember HPV 6 and 11, they are the low risk one, causing carcinoma 2 and the HPV 16 in 30, the high risk one. Factors are the early age sex and the multiple sex partners with multiple women, the oral contraceptive pills. Now, common warts of the vulgaris. It is caused by the type 1, 2, 3, and 4, and very important condyloma equipment types. Type 6 and 11, that is a low risk type, that 6 and 11. So, what we need to remember HPV 6 and low risk one, carcinoma 2, and 16 and 18 causing 31 and carcinoma cervix with high risk conditions and condyloma equipment 6 and 11. Alright, other than epidermodysplasia, varicoplasma, and what is a vaccine? The prophylactic cases using HPV 18. Alright, and for the therapeutic cases using HPV and 18, early non-structured protein or late protein. For the prophylactic and the therapeutic vaccines, we use HPV 18. Both quadrivalent Gardasil and the bivalent cervix vaccines are licensed. Gardasil, that is what 6, 11, and 8, and it is what it is 18. Alright, vaccines are licensed. Now, HPV, the type and the what is the disease? HPV type 1 2 will cause varicose vulgaris, 1 to 4 with plantar warts, 3 and 10 with flat cutaneous warts, 5 in it carcinogenesis, an important one to remember, 6 and it will cause what? No treatment. Okay, 6 and 11 that was also a low risk of 6 and 11 that is a low risk of carcinoma, that is what genital warts or condyloma acne. Other than this, 16, 18, 31, 33, this will cause what? Anogenital cancer and it is high risk carcinoma cervix. Now, HPV vaccine, Cervarix, Gardasil, and that is a Gardasil. How many doses? 3 doses. Cervarix, that is it prevents against Cervarix, that is 2 symptoms, that is a HP 6, 11, Gardasil, and the Gardasil 9 against 60 and 18, 30, 58, and the HPV type 6 of 11. Okay, so remember that Gardasil is what quadrivalent against 6, 11, 16, and 18, and Cervarix and 18. Other Papua and the DNA viruses, that is a JC virus, that is called ML, and the BK virus causing infection, virus, regulating virus, regulating virus. Now, next one is what Prophage. That is virus that depends on the bacteria, attacks on the bacteria, and the host is the bacteria, and it is made up of the DNA that is surrounded by what? Hexagonal protein code. Hexagonal protein code. And consists of the hexagonal head, neck, and the tail. Head, neck, the tail. Two cycles, important one, lytic and the lysogenic. Lytic, the phage replicates the cytoplasm and will lyse the host bacteria. And lysogenic cycle, that is a phase gene, is incorporated in the DNA bacteria. Alright, and lysogenic to lytic interconversion can occur. The lysogenic phase can go into the lytic phase. We have read this into the transcript. Now, where we can use the bacteriophage or the phage typing, that is Staphylococcus, the VI antigen of the Salmon typhi, and for the Vibrio cholera, the phage assay, depending on the number, size, and the mark produced by the bacteriophage. Phage therapy, they can lyse the bacteria, so it can be a treatment for bacterial infection. For the transduction, we already see, and for the diagnosis of myco. Alright, it codes for the toxin. Phage code toxin by the mnemonic ABC. Remembered. A for toxin, B for toxin for cholera, D for antigenic streptococcus pyogenes. We'll do some few of the question answers now. Alright, now starting with the first question. Now, what is the most common cause of the sporadic viral encephalitis, Japanese B encephalitis, HSV, HIV encephalitis, or rubella encephalitis? What is the most common cause of the sporadic viral encephalitis? We read it in the yesterday's session that what is the most common cause of the sporadic viral encephalitis? So, what is the answer? What is the answer? Yesterday we read that the most common cause for the sporadic viral encephalitis is what? Is what? Herpes simplex encephalitis. Okay, herpes simplex encephalitis. Now coming to this next question, true about the herpes virus. True about the herpes virus that herpes simplex virus encephalopathy is treated with the acyclovir. Orophageal vomit is common in HSV-1. Recurrent genital infections are seen in the HSV-2 and the recurrence is rare, the HSV. So what is true? More than one options are true in this case. What is true for the herpes virus? Now the treatment we give for the HSV is what acyclovir. Acyclovir is what the drug of the choice, and we remember that Herpes family. Herpes family, alpha, beta, and the gamma. Alpha subfamily had what HSV1, HSV2. All right. So HSV encephalopathy is treated with the acyclovir. This is true. And the HSV, the main symptoms were orofacial. Orofacial, and it was through the direct contact. The direct contact, all right. And it is the orofacial involvement that is more common in HSV1, and it is recurrent genital infectious involvement in HSV2. Above waist symptoms, rashes mainly occurred there in the HSV1, and below waist mainly occurred in two. Recurrence is common both in the HSV1 and HSV2 because herpes is an example of the persistent infections virus, that is a latent virus infection. HSV1 and 2, that is one was latency was seen in the trigeminal ganglia, and for the two it was a sacral ganglia. Now, coming to the next one, regarding HSV2 infection, primary infection is usually widespread. Recurrent attacks are due to reactivation of the latent infection. Encephalitis is a for the included HSV2 is a common cause, and the newborn may acquire the infections via the birth and at the time of labor. And treatment is with acyclovir. So, which of the following is true? Okay, so what is true for the HSV2? Now, coming to each option one by one, primary infection is usually widespread. Now, for the herpes, now primary infection is more aggressive than any recurrent infections because the chances of the recurrent infection are less. एक तो और वो तभी होता है if there are some stimulus factor like fever or the emotional or any physical stress, emotional or the physical stress, or under the UV light or the immunocompromised people, the recurrent infections occurs. And if it occurs, it is less severe than that of the primary infection. So this is true. Recurrent attacks are due to the reactivation of the latent infection. This is also true. And encephalitis is more common with HSV1. Encephalitis is more common with HSV1. Although the drug resistance is more in HSV2, and HSV2 is more neuroviral. This HSV1 is more neurovirulent. So encephalitis is a common cause for the HSV1. Newborn may acquire the infection by the birth canal at the time of the labor. When we read कि जब न्यूबॉर्न या तो if the gap within the delivery is more than 5 days, like the patient will have delivery after लाइक सपोज दैट कि ना 5 दिन बाद उसकी डिलीवरी होने वाली आफ्टर मोर देन 5 days, then the chances of the herpes will be less as compared to within 5 days to after 2 days of the delivery. Okay, so -5 to +2, the chances are highest for the herpes infections as the at the time of the birth it is highest. Okay. And what is the drug of the treatment? It is the acyclovir. It is what the acyclovir. Now coming to the one. Now shingles are seen in the infectious mononucleosis or the herpes zoster or the chicken pox or the smallpox. So shingles are seen where in the Those shingles are seen where in the herpes zoster, in the herpes zoster. Now, varicella zoster. Yeah, if at the varicella zoster cause the chicken pox. The chicken pox on the primary exposure and what and shingles in the current current infection. Okay? Shingles or the zoster in the recurrent infection. And what was the chicken pox? What was the characteristic? That is the dew drops on rose petal appearance. Dew drops on the rose petal, dew drops on the rose petal appearance. Alright, congenital varicella. Congenital varicella infection can cause all the microcephaly, limb hypoplasia, cortical atrophy, and cataract. And cataract, so which it doesn't cause. So congenital varicella infection, when we read about the congenital varicella syndrome, it was having what the patient presented what? The patient presented with chorioretinitis, cicatrization of the skin, okay, CNS defects and limb limb hypoplasia. Limb hypoplasia. Alright, so patient presented with that CNS defect, microcephaly, limb hypoplasia, alright, chororetinitis, cortical atrophy as well, and what is not but cataract. Cataract what not seen congenital varicella infection. Now coming to the next question. Coming to the next question. A baby is delivered with the scarring of the skin and the deformed limbs. So the following indirect infection can be held responsible. It is CM, trypanoma, varicella, or the rubella. Scarring of skin with limb defects. Just now we see where in the varicella. The varicella that was what presented with the limb hypoplasia, cicatrization of the skin, cicatrization of the skin, and as defects, and what else? You retinitis. Now coming to the next one. A mother delivers a baby 3 days before developing the chicken pox. Which of the following is true? There is no risk to both mother and the baby. Baby has a risk of congenital virus infections, gives antiviral treatment to the mother, gives no treatment to mother, and gives antiviral treatment to the baby. What is the answer? Baby will have a risk of congenital viral infection. Why? Like suppose mother she is having what chicken pox. Yes, she is having chicken pox after 5 days of delivery. Like mother is having the chicken pox, but just after 5 days before the delivery, she is having the chicken pox. Okay, so the duration of the delivery is more than 5 days that she will give birth to a baby after 5 days. Okay, but now in this duration, now although the mother had the chicken pox, लेकिन mother में antibodies बन गई, so that maternal antibodies will be transferred to the baby and they will protect it to the baby. Okay, so the five is the criteria days, but if the mother she is having within 3 days of the delivery, she is having within 5 days of the delivery, the maternal antibodies had not been formed. Mother has acquired chicken pox, so the baby has the highest transfer of the chances of the having the chicken pox. And since the mother doesn't have the maternal antibodies, that is not passed to the baby, so baby will have what higher chances of the congenital varicella infection, and therefore baby will given the varicella zoster immunoglobulin. Within 96 hours of the infection. Within 96 hours of the infection. All right. If the if the mother gets chickenpox after 5 days before the delivery, so there are maternal antibodies that are protected to the baby. But within the 5 days, the maternal antibodies have not been formed, and therefore baby will have the high risk of developing a congenital varicella infection and more severe cases with the pneumonia. Okay, pneumonia. Baby will develop what? Pneumonia. And for the prevention, we give what? VZIG, that is varicella zoster immunoglobulin within 96 hours of the exposure. Now, coming to the next one, treatment of the varicella immunocompetent host is acyclovir or acyclovir vaccination and prevention of the complication or the immuno. Treatment of the varicella, the point that we need that treatment of the varicella, treatment of the chickenpox in the immunocompetent host is based on the avoiding of complication, is based on the avoiding of the complications. And for that we recommend the patient to have the daily bath, all right, and that is main basic aim is what having the to prevent the complications. Now coming to the next one, that all of the following are true about the chickenpox, except the chances of the occurrence of the herpes zoster is about 10 to 30%. Rashes are commonly on the flexor shell surface. Secondary attack rate is 90%, and all the stages of rashes are seen at the same time. So all of the following are true. The chickenpox, the chances of the recurrence of the herpes zoster is around 10 to 30%. This is true, and the rashes are mainly on the flexor surface. For the smallpox, the rashes are एक तो deep seated, and they are on denser surface. While the rashes for the herpes zoster is on the flexor surface. Yeah, secondary attack rate is high because chickenpox is what this is highly common. Herpes zoster is what? Highly contagious. But highly contagious with high secondary attack rate 90, and all the stages of the rashes are not seen at the same time because they have what? Pleomorphic rash. Pleomorphic rash, that is the rash appear in the stages. The stages. Now coming to the next one, varicella zosters remains latent, the lymphocyte, monocyte, trigeminal ganglion, or the plasma cell. So where does the varicella zoster remains latent? Now after the attack of chicken pox or varicella, the virus remains latent with the trigeminal ganglia. Okay, and after the stimulating factors, be it the fever, physical, emotional stress, or the immunocompromised person, the reactivation of the virus will take place and causing what? The shingles or the zoster. Now the test for the chicken pox are what? Pharma, ELISA, Vidal, or the PCR. So the test for the chickenpox, test for the chickenpox or the fluorescent antibody on the membrane antigen, ELISA, and the PCR, all we do for the chickenpox, all we do for the chickenpox. Remember, we do not do the Vidal. Vidal is what? The test for which disease? That is Vidal we do for what? Vidal we do for the typhoid. Now, coming to the next question, that is, infectivity of chickenpox lasts for till the last scabs falls off, or 6 days after the onset of the rash, or the 3 days after the onset of the rash, or till the fever subsides. Chickenpox effective effectivity, that is 2 days. Rash, ठीक है? That is 2 days, 5 days. What is the most appropriate answer? That is 2 days, 5 days after the onset of the rash. Which of the following viral disease is associated with the reactivation? Which of the viral disease, that is the neurodynia, shingles, infectious monocytis, or the viral arthritis? 21. So the fall disease is associated with the reactivation. Which of the following is associated with the reactivation? That is what shingles or that is, it is what latent wear in the trigeminal ganglion. After the primary infection with the chicken pox, the virus is in the trigeminal ganglion that leads on activation shingles or the zoster. That leads to shingles or the zoster. Now, coming next, a patient is suffering from the painful vesicular eruptions at T4 dermat of the cause is EPV, herpes V, or herpes simplex. The skin that is innervated by the T4 dermatome, what we have? We have what? Herpes zoster. Herpes zoster. Now, the next question, CMV infection, immediate diagnosis by the DNA estimation, antigen detection, isolation of the virus, or ELISA for the serum antibody. The CMV infection, immediate diagnosis by what? By direct DNA by direct DNA estimation. Other methods are also used for the CMV infection immediate for the diagnosis, but for the immediate by the direct DNA infection estimation. And for cytomegalovirus, what we learned that it is what the largest member and it causes the enlargement of the host. And what else we needed to remember that inclusion body have the typical house appear inclusion bodies that is both intranuclear and cytoplasmic inclusion bodies. What else has what internuclear and cytoplasmic inclusion bodies? That is what measles. That is what measles. Now coming to the next one, 40 a 40-year-old man underwent the kidney transplantation. 2 months after transplantation, he developed fever and the features suggestive of bilateral diffuse interstitial pneumonitis, which are the for most likely etiological agent HSV, MV, virus. So easy one. Now, when we remember, we do that in kidney transplantation in 1 to 4 months. If there is infection, the patient has developed the infection after the kidney. What is the pathogen that is responsible? Is what cytomegalovirus is cytomegalovirus. Please remember, very important. Now coming to the next question. A person with a renal transplant which developed the infection of graft within months. Most common infection is polyoma, BK virus, CMV, hepatitis C, or HSV. The same that the patient had the history of the kidney transplant and after developed what he developed the infection that is mainly the bilateral interstitial pneumonia is the most common pathogen 1 to 4 month that is cytomegalovirus. A neonate has a hepatosplenomegaly and he sustains house eye appearance inclusion. What is the most this diagnosis? The CMV, HIV, or rubella. Easy one. Question itself is saying that he is having owl's eye appearance of the inclusion bodies. Okay, and this is what both intra cytoplasm is. In this, we also have me that is for the intranuclear is present where in the also appears present where cytomegalovirus virus. So patient with the hepatosplenomegaly with stained and revealed house eye appearance body MV. Okay, so some few questions are left that we'll cover tomorrow for the Epstein-Barr virus, and we'll cover the remaining of the PYQs, the virology. So it was a short session of the PYQs, and the theory part that we were left with the DNA viruses. We covered that. To use my code, that is 10% of the discount. I'll see you at the same time. We'll cover the PYQs of the viruses in the remaining session. So see you tomorrow. Until that, here and bye bye. And please do press the bell icon, do like, share, and subscribe. And you can download the lecture notes from it as well as Academy. And follow me on the Unacademy on Chaudhary category and on the Unacademy channel so that you will get the note the class and keep safe at home. Take yourself, take care of yourself. Safe right now. All right, and even viral so because we need to give the examination INICET and the FMG respective. All right, so until that, take care. Bye bye.